Nakia Clark, and I'm the Senior Community Outreach and Engagement Manager at Roswell Park. Welcome to another episode of our on-demand videos hosted by our Center for Translational Research on Cannabis and Cancer. As many of you know, New York State legalized cannabis for recreational adult use in 2021, and we hope to quickly delve into some of the ins and outs of what this new law means for you and your loved ones as you navigate the cannabis landscape. At Roswell Park, we have a group of dedicated experts who are leading the charge on scientific evidence and research as it relates to cancer prevention, care, and public health. Welcome both. Thank you for coming. Joining me are Dr. Amy Case, Chair of the Department of Supportive Care at Roswell Park, and also Ms. Louise Ross. She is a breast cancer and lung cancer survivor, and she's interested in getting some information and knowledge about medical cannabis. Welcome, ladies.
Thank you.
Thank you.
Thank you. So one thing that we hear the most is, does cannabis cure cancer? Dr. Case?
That's the question of the day.
Yeah.
I think there's a lot of false claims out there that cannabis industry may push out that cannabis can cure cancer. Unfortunately, there's no scientific data to date that shows that cannabis leads to curing cancers. The way that cannabis relates to cancer is still being studied, and there are some data to show that cannabis in some cancers actually can make the cancer grow. And then in other cancers, particularly glioblastoma, which is a form of brain cancer, there was a small human trial that showed that those patients who took cannabis survived longer. And so because there are mixed studies and lots of research still underway, that question has still yet to be unanswered.
Okay, so then what can you tell patients or people that just want to know, what does it actually treat then? What does cannabis treat?
There are many things that patients use medical cannabis for, and to clarify, many people call it marijuana or medical marijuana. For the sake of this discussion, in the medical field, we refer to it as medical cannabis. So we study medical cannabis for patients for several different symptoms, and I'm a palliative care physician, so my job is to take care of patients who have cancer that is advancing, who may have pain, nausea, anxiety, depression, trouble with appetite and eating, weight loss, and things like that. And so we give medical cannabis in our clinic to patients, and they report to me several things that they feel are beneficial. As far as what do the studies show, there is mixed data on whether cannabis helps pain. You need to treat 11 patients in order to get a response for pain. So we call that the number needed to treat.
That's
is 11.
11.
And that is out of a Cochrane database review, which is a very large study. And there's been several studies that have been mixed, as far as some of them show benefit and some of them don't show benefit. Mm-hmm. And so the jury is still out as far as strong evidence to suggest a benefit for pain. The best type of pain patients may feel is improved is what we call neuropathic pain or neuropathy of the fingers and the toes, which often happens as a result of chemotherapy. That type of pain responds better than maybe some other types of pain that patients may have.
And that type of pain is experienced most commonly, you said, with
It's a very common type of cancer pain, correct, peripheral neuropathy. And then the other real large improvement that I see with our cancer patients, and also is duplicated in the medical science, is an improvement for nausea or vomiting related to chemotherapy. And that is actually one of the best well-studied improvements as far as medical cannabis. And there's been studies that show that medical cannabis, when compared to other anti-nausea medications, it is actually superior to some of the other medical indications for nausea and vomiting. So that is one that does show promise. And then appetite is another thing that patients will take it for. And we've heard of cannabis making people want to eat and be hungry, the munchies, whatever you want to say.
Yeah.
But I think that people will take that and feel more hungry. And cancer, one of the bad things about cancer is that it robs us of our appetite, and we often don't feel hungry. Another thing that chemotherapy does is it robs us of the taste for foods. Mm-hmm. So often our taste can be impaired. And so what can happen then is when you take the cannabis, it can enhance the appetite and make us less nauseous. So those two things go together.
Now, Louise, with your experience with treatment for your cancers that you've survived, can you relate to any of the symptoms that Dr. Case was mentioning?
Definitely, especially the appetite and not wanting to eat. I experienced everything that the doctor mentioned, and it would have been nice to have this information back then because it could help with the neuropathy. So I went through all those symptoms and that, lots of pain. So I wish I was more informed back then when I was going through my chemo and radiation.
So this is a really great step to start informing our patients and those just interested in learning more. Yes. Now, since it's, we do refer, or prescribe, medical cannabis, but what is the process to get that card to actually get it?
Right.
What's the process?
So actually, the process of a physician giving medical cannabis to a patient is not prescribing the traditional way that you would write a prescription with a dose. The way it's done now is actually, I think, needs some improvement. But right now what happens is the physician actually certifies a patient. And so they give permission in writing through the Office of Cannabis Management, New York State online registry. So we actually will register a patient. We will give information to New York State about that patient. They have to have a New York State license. And then we also screen them for risks associated with cannabis use. And so we won't certify a patient for medical cannabis unless we know that they'll have a low risk of adverse effects and a high chance of it being safe. And so there are a few things that we talk to patients about, if you'd like me to tell you about those things.
Sure, yeah.
So a few things that we talk to our patients about when they are pursuing medical cannabis. So medical cannabis can cause your heart rate to go up. And so if you have a cardiac condition underlying, such as heart attack or prior stroke, or something called atrial fibrillation, which is an irregular heart rate, if you have those issues in your past history, cannabis could make those worse. And so there is a risk of heart attack and stroke after smoking marijuana, which is recreational. Medical cannabis is what we recommend is often oral formulation.
Okay.
And so the way the body responds to smoked is different than the way it will respond to oral. And so there's probably a higher chance of fast heart rate when taking the smoke because it's very immediate response in the body. And so that risk may be lower if you're taking it orally.
Now, orally, is it
by mouth.
A pill or liquid?
It comes in many formulations.
Okay.
Powders that can be mixed into a liquid and drank.
Okay.
Gel caps, oils, and pills. And so the medical dispensaries have multiple menu items of different types of products. So what happens is then and then another thing that we have to look out for as a concern is potential history of psychiatric problems or psychosis or bipolar or schizophrenia or any disease like that that has caused paranoia or hallucinations in the past. If a patient has a family history or a history of that, we will talk to them about the risks and benefits because cannabis can be psychoactive, meaning that it can cause, it can bring on feelings of, out of body or a type of, paranoia in some patients. Okay. Although we will recommend lower doses of the chemical in cannabis. You can recommend different formulations or milligrams of the different chemicals within the product. And there are different formulations we'll recommend to make sure that those side effects are less likely. For example, lower THC products tend to have a less risk of being psychoactive.
Okay. So, in other words, medical cannabis can trigger some, mental health issues.
Any type of cannabis or marijuana can do that. I think the higher the THC in the product, and so recreational products tend to have higher THC rather than compared to lower THC oral products that we would recommend for medicinal use. And so I think that if people are getting them from the reservation, they have to be really cautious because those products have high THC and can have a higher chance of cardiac or psychoactive side effects. And so we go ahead and talk to the patient all about those risks.
Right.
We talk about drug interactions, and we can talk a little more about what those are. And then once we deem them to be a good candidate for medical cannabis, we will then go on to the New York State website, we will register them, and then they print out a piece of paper, they get a card in the mail, they take that card to a medical cannabis dispensary, which is not a pharmacy, it's not at Roswell Park, it's a separate business that actually dispenses the medical cannabis products. And those products are not cheap, and they're not covered by insurance.
Okay.
And so those medical cannabis products can range from anywhere from $80 to $130 for once a day use. Many of our patients use it more than once a day. So you could be looking at prices double or triple that.
Hearing you talk all about this, we know now that this process to receive and use medical cannabis is very thorough. It's a thorough process that you have to go through, which is important because you have to be informed. Let's say, for instance, there's a patient that's using recreational cannabis. So they didn't want to go through the whole process. They've heard about the good things about it. It can help with their, pain and symptom management. So how is this different from the cannabis that somebody would get through the process you just described?
I would say the majority of the patients I see are using some form of product that's recreational rather than medicinal. And what we caution, especially cancer patients about, is that many of the recreational products are inhaled. So for example, smoking marijuana, right? So you're smoking marijuana. When you're a cancer patient, your immune system can be depressed because you're undergoing chemotherapy or some other type of cancer treatment that can lower your immunity. And sometimes immunotherapies rev up the immunity, and we want your immune system to be working so it can fight the cancer. One of the properties of cannabis that is, one of the reasons why it works for pain is that it's an anti-inflammatory and it suppresses the immune system. And so, similar to like a steroid drug, we would avoid that when we're using immunotherapy. And so I talk to patients about some of the things that they need to be concerned about when using recreational products. So recreational products that are inhaled, you can be inhaling some of the actual plant compounds into the lungs. And so as soon as a plant is picked from the ground and the plant itself dies and it's dried up and rolled into a cigarette and smoked, it will have mold on it. And no matter how well that plant is grown, in the best circumstances out there and cleanest conditions, there is still mold spores that can be on that plant. And so you're inhaling microscopic amounts of mold. And so in a healthy person with an intact immune system, that is not usually a problem. If you're a cancer patient with not a lot of immunity because you're on chemotherapy or your counts are low, you could be at risk for a pneumonia or fungal pneumonia, and that has been reported in the literature. So that is a big risk, is inhaling. Plus, if you're inhaling anything into your lung, that can be harmful to the lungs. And so smoking is harmful to the lungs. We know that. And so cannabis smoke is pretty toxic and can be even more harmful than cigarette smoke. And so we really caution against any type of smoked recreational use. If people are going to be using products that are oral, that they get from a friend, or that they're growing and manipulating the product into an oral form, or baking into a brownie or whatever, the edible, whatever they want to call it, that product would be safer recreationally. So I usually talk to my patients about trying to use an edible product rather than an inhaled product. Vape is a big way that people take recreational products. So vape cartridges are also can be dangerous because they are plastic cartridges, which in any type of plastic cartridge where there's moisture, you can develop bacteria. And if you're inhaling bacteria, the same thing applies. If you're a cancer patient inhaling bacteria, you can be at risk for what they call vape illness, which is a pneumonia.
So you've just given us a wealth of information that the average person will never know. We wouldn't know this. So it's so much information, and I love the way that you deliver it and you just talk freely and open about it, so we know that yourself and other doctors at Roswell, that it's important to any cancer patient to talk to their doctor. There's no judgment. So, disclose everything that you're doing, because we want to make sure that our cancer patients are receiving the best treatment and learning, what can interfere with their cancer treatment, the interactions between different drugs. And so I think you just kind of stripped down to the bare, this is what it is. Very simple and plain to listen to, but you encourage people just listening to you talk. And I know, Louise, you would feel very encouraged just to talk to her.
This is very informative. I mean, I've learned a lot of information here today. I mean, a lot. And like I said, I wish I had known this information as I was going through my process. But getting this information has opened up a lot for me about the cannabis, medical cannabis. So I'm very excited to learn this information and pass it on.
There's a few things that I do want to say about the safety of cannabis or marijuana. And so we always counsel people, it is a drug. And so I think in the community, there is a perception that it's a natural compound, it's a plant, how can it really hurt me? It's not going to do anything to harm me. And that is very false, actually. It has about 400 chemicals plus in the botanical product. And then synthetic cannabis, there is forms of synthetic THC. The two chemicals in cannabis are THC and CBD. You may have heard of these. Mm-hmm. These are called cannabinoids. But the plant itself has many chemicals. And so when we ingest these chemicals, they can make us sedated or tired. If you take that with alcohol, or you take that with an opioid like hydrocodone or morphine or one of those pain medications, or if you mix it with a benzodiazepine, which is a sedative medicine that we give for anxiety. Okay, those medications, when combined, 2 of them or 3 of them together, can make someone quite altered and actually really unsafe behind a wheel. And so if you're going to take a recreational product on your own without the counsel of a physician, it is really important that we tell people to take those in a safe way, meaning that I generally tell people to take them at night. If they're going to do it for the first time, start with a lower amount of milligrams in your product and take it at night, so in case you have a bad reaction or you're really, really sleepy afterwards, that you're not going to get behind the wheel and drive, because that could be really unsafe.
Now, this is an interesting question. So people that want to, take medical cannabis, but they want to grow their own. What would you say to that?
I would say that to grow your own cannabis, you really need to be kind of like, someone who's very schooled with how to do this, because I think that you can easily do it the wrong way and end up with a product that could be not helpful. And so I don't want to comment too much on that. I can tell you that New York State does allow people to possess cannabis and to grow a certain amount of plants. And so there is information on the Office of Cannabis Management, OCM website. And so it is legal now. If people choose to do this, that is up to them. But generally, we would recommend that they obtain cannabis through the medical way and through the dispensary, which is it's a process that is overseen by regulatory people who come in to make sure that process is done safe, to avoid things like mold and other things growing on the product.
Right. Well, that's excellent information. As we wrap up this video, are there any last words that you'd like to share? You've really given a great explanation and helped us understand the process of how medical cannabis can help treat different symptoms for the cancer patient. Is there anything else that you'd like to add?
There are a few other symptoms we do use it for, and I think that patients seek it for anxiety and sleep and mood. And I think that those reasons are valid. And actually, as a cannabis researcher, we are studying medical cannabis for insomnia or lack of sleep. And I think that is one symptom that I find after giving it to hundreds of patients that they report back to me that they feel it's helpful for. And so I do think that the jury's still out as far as medical evidence, because it's so highly regulated. It's hard to study it because it's federally still illegal. And so you need to get lots of permissions from the government and things like that to study the drug. And so here at Roswell Park, we are going through some of those regulatory processes in order to study it in humans specifically humans with cancer, which is an area of research that is yet to be untapped.
So Louise, after hearing some of this information that's Dr. Case shared and thinking back on your cancer treatment, if this option was, available to you and discussed with you, with your doctor at the time, what do you think your major concerns or questions would have been?
One of the main things, my concern would have been helping me through the pain, going through the pain and not being, the appetite, losing my appetite, gaining my weight back. So therefore, I would be concerned with, would it be addictive? Is this medical cannabis, is it addictive? That would be one of the main questions I would have.
I mean, we hear about that a lot, people that unfortunately get addicted, patients get addicted to pain medication. And so I think that's probably number one on a lot of, cancer patients' concern list is it addictive? And then also, I would think, because I'm just so engaged with hearing, Dr. Case talk, but a lot of other cancer patients may not want to ask or even disclose that, I've been using, cannabis, on the side. And did you feel comfortable talking with your doctor during your time of, cancer treatment?
Yes, I felt very comfortable. But the one thing I would be concerned with would be the stigma with it, the recreational marijuana, and myself just knowing it's a drug, and that's what I would be concerned about, the stigma with it that goes along with just the marijuana opposed to the medical cannabis.
Right, because we now know that, as Dr. Case explained, there's kind of two groups. There's the recreational use of cannabis, and then there's the more process, going through the process for the medical use of cannabis. And you also touched on addiction, and that's something that we know that we hear in the news, and unfortunately we hear that how some patients can become addicted to pain medication. Dr. Case, can you give us some words on addiction and your thoughts on addiction?
I think that you don't have withdrawal like you would from an opioid the same way you would with cannabis. So you don't get withdrawal, and so addiction does not happen the same way it would with other addictive drugs like cocaine or opioids. However, people do get quite attached to their cannabis, and they tend to use it, and they go back and use it again because they like how they feel on it. So there can become psychological attachment.
Well, I thank you both for joining me on this video. Just know that these conversations are going on at Roswell. Our doctors are excited to share the information they have. If you have any questions as a cancer patient, again, a special thank you for watching, special thank you for being here. If you'd like more information on cannabis and cannabis research, you can visit roswellpark.org/cannabis research. Thank you all. Have a great day.